This video is to help you understand exactly what we'll be doing and going over with our students in post-conference this week. So I am referring to the Clinical Day 1 First Day Experience, also known as a Shadow Day. You'll see that in post-conference, this is what we're supposed to talk about. So the clinical first day experience evaluation, that's the form that I printed off for you guys. That was for this specific day. And you are to give that to them. In post-conference, they can fill it out and give it to you at that time, or turn it in with their paperwork, whichever you prefer, they prefer. We're also going to be discussing nursing diagnosis and supportive data. So you will also see that their final paperwork, just to review, is a health history form if they get the opportunity to do it. Remember, they have to do at least 3 satisfactories, and a Lippincott advisor worksheet. I have attached the answer key to this Lippincott advisor worksheet. However, you are not grading it or giving feedback on it. I just attached the key in case they have questions. This assignment was designed by Dee Dee to basically show the students what all resources they have available to them, and it helps navigate through it, and so hopefully this will help them throughout the semester as well. So let's begin with discussion of nursing diagnosis and supportive data. I have attached the nursing process PowerPoint that Dee Dee prepared as for her lecture that she is doing before they come to clinical this week. So this is what we will use every week when we discuss certain things. So this week is discussing nursing diagnoses and supportive data. Basically, I print these pages off. You don't have to if you don't want to, but I print them off and I go over them, so I'm using the same terminology. So the goal of an assessment, I just review this with them. You can walk through it understanding that when we're taking data, we're doing subjective and objective information. When we're doing diagnosis, we're collecting that information. We are using our clinical reasoning, so we're analyzing, synthesizing, reflecting, and drawing conclusions. And then our diagnosis is basically creating a list of suspected problems and diagnoses, ruling out similar problems, narrowing actual and potential problems, and so on. Sorry, I went too fast. So a nursing diagnosis, after gathering all the available data and analyzing it, the nurse uses clinical reasoning to pick a nursing diagnosis. Nursing diagnoses do differ from a medical diagnosis. Very important for the students to understand. In the front of their concept map books, care plan books, is the list of NANDA approved diagnoses. I also gave a copy of that to you. We are currently working on narrowing that down, but feel free to narrow them down yourself. Pick 15 or 20 that you think is appropriate for the students, just to help them. But just to review with the students, that medical diagnosis is a clinical judgment identifying the illness and disease, and a nursing diagnosis is a clinical judgment on a client's response to actual or potential health problems or life processes. So just making sure that they understand the difference. I think Dee Dee goes into pretty good detail during her lecture. This explains what NANDA is, how to know how to pick your diagnosis. So this is all dealing with clinical reasoning. So after you cluster all your data, review the data and pick tentative nursing diagnoses. It may include current health problems and potential health problems. There's 5 different types of nursing diagnosis: actual, risk, possible, wellness, and syndrome, and explaining how they write it. Now, know that we teach nursing diagnoses, how to write them, in 2 parts. There are 3 parts, but we want our intro students to do a 2-part nursing diagnosis. So first you pick the best NANDA diagnosis, and then add related to, and the related to becomes the second part. So you add the etiology, the causing or contributing factors of the problem. This is simply just reviewing. Remember, they will have had this already before coming, so we're just reviewing this. The second part is important because it tells you where to start thinking about interventions. If you just had the diagnosis of pain, you would not know if it was a headache and you should put a patient in a dark room with a cool rag on a forehead, or if it was surgical pain and needed a narcotic, and be taught how to splint when coughing, yada, yada, yada. That's just to help them understand. Here's some examples. Acute pain, which is a NANDA approved diagnosis, related to, so here comes the second part, bone and soft tissue trauma. Note that we did not write left knee replacement here. We did not write tibial fracture, because those are medical diagnoses. We don't use medical diagnosis in the related to part of the nursing diagnosis. Impaired mobility related to acute pain in the knee with ambulation. Okay, I think that might be as far as we go this week. Let me just check. Oops, I went too far. Be careful. Sorry. Yeah, be careful of common errors. So using signs and symptoms of a disease instead of the actual problem, having both parts of a nursing say the same thing. Acute pain related to pain in knee. Well, right. Making legally inadvisable statements, making value-laden statements, including medical diagnosis and the etiology, which I just reviewed. And we don't have to really prioritize this week. So I just wanted to kind of go through this. That's as far as we're going this week with this PowerPoint. So all the way to PowerPoint 10. I have attached this. It's a first aid clinical experience case study. So now that you've gone over and reviewed what they did in the nursing process, you're going to hand them this case study. So I believe there's 4 to a page. You can just print off a couple of them, cut them in half, and hand them out to your students, okay? And then so we're going to go through a nursing diagnosis, okay? They don't have anything to turn in, but they were supposed to bring a concept map with them, okay? So this is why they're bringing it, so we can go through it. So based off this case study, just go through it with them, okay? So read it out loud, okay? So I did it in steps for you. Number 1, have the students pull out the concept map and read the above case study out loud. Explain that you are going to work on the first page of the concept map today. You will start by helping them identify key problems. This is just an exercise and does not have to be written out in the concept map. So we're gathering that data, right, addressing key problems. As a group, brainstorm about patients' key problems. And here are some examples from up here. Crying, pain is 7 out of 10, history of asthma, worst pain with movement, riding scooter in bare feet, landed on left shoulder, in quotes saying, now I won't be able to play football, and some vital signs. Talk to them about subjective data, things that the patient says, and objective data, things that you observe. Okay, remember, we're wanting to gather all of that. Number 2, have them cluster the above data into related topics, i.e. pain. So remember, we're clustering all that data that we've gotten. Not being able to move arm without feeling pain and crying can be clustered together. Of course, there's other things that you can cluster together. I just gave you some examples. Then have them look at their NANDA list and brainstorm about possible nursing diagnoses and place them in the appropriate category. And I have an example down here. So this is the first page of their nursing diagnosis, okay? So under risk for inadequate gas exchange right here, see under respiratory, risk for inadequate gas exchange related to history of inflammation of the airways. Asthma is a medical diagnosis, and we can't put asthma as a nursing diagnosis. I put that there so that you could bring attention to that. That's a risk for inadequate gas exchange related to history of inflammation of airways. Remember, we can't say related to history of asthma because that's a medical diagnosis. So what is the etiology of asthma? It's an inflammation of the airways. There are other diagnoses than the ones I've shown in this example. This is not exclusive. So musculoskeletal, you see I put acute pain related to shoulder trauma, impaired mobility related to pain in shoulder. Okay, knowledge deficit related to scooter safety, anxiety related to pain, grief related to not being able to play football. Okay, so those are just some nursing diagnoses from the NANDA list with the 2-part written out. Okay, then we want to have them prioritize their nursing diagnosis. I lied about the nursing process. You're actually going to go down to prioritization of the nursing diagnosis right here. So you're going to go, to number 11. So when we're prioritizing, I always tell them life-threatening problems always should come first. Okay, so what's going to kill them first? I know that seems harsh, but that's a great way to think about it. What's going to kill them first? And sometimes there's no data there that says that something would kill them. Okay, but life-threatening always comes first. And after that, diagnoses are placed. It may be just a matter of personal judgment. Okay, best if the patient helps you determine which is a priority. So just based off that patient's presentation will help you do it. So you'll see in the example here, we put acute pain, impaired mobility as the number 1 priority. 2 was anxiety, because this was really feeding feeding this one, and then 3 was a risk 4. Okay, if that doesn't make sense, please let me know. But help them prioritize. I just said top 3, so obviously you would have you have more than 3 here, but the instructions just say to have them prioritize their top 3. Okay, there's room for discussion. Like I said, most of the time, risk for diagnosis do not prioritize over the actual diagnosis. And note that I said most of the time, okay? Beneath each diagnosis, list the supporting data. So subjective and objective. This is some things that you had talked about before that gives evidence to each problem. Again, there's discussion to this, and this is not inclusive. So you'll just see here that, under risk for inadequate gas exchange, we put a history of an asthma and a respiratory rate of 24. That's data that you collected that supports this nursing diagnosis. Also, it says acute, here's acute pain. We have rates pain 7 out of 10, fell on his shoulder, crying, cradling arm, hurts to move. If we had any, if we had x-rays, we could put those here. If there was any labs in anything, like if we had, an arterial blood gas or something, that could be up here. Knowledge deficit, some supportive data is that he didn't have shoes on while riding his scooter. Underneath this psychological, we have a respiratory rate of 24. Now I won't be able to play football, and of course there's much more there. So I hope this helps. This is just the activity that you're doing with your students. They're not turning any of this in. This is just basically getting them ready for the coming week. So let them know that the next week when they come, they're going to have a rough draft of that assessment form, so the paperwork that they come and begin to fill out prior as they're picking up their patient assignment. But because you've just gone over this, now they need to have the first page of their concept map for top priority nursing diagnosis. So, this, they're going to say, oh my gosh, how in the world? But this, we just want to see that they are starting to think the night before based off the information they've gathered. Of course, some of this can change once they meet their patient and start assessing their patient, but we want them to start thinking. So have them come up with 2 or 3 nursing diagnoses with related to statements and even some supportive data. And you can talk about that when they're giving you a report this morning, okay? So I hope this video helped understand what we're going to be teaching them in post-conference for Shadow Week, first day clinical experience. Again, if you have any questions, please just let me know. Have a great rest of the day, guys. Bye.